Have you ever forgotten a drug name or side effect during an exam despite studying it many times? Pharmacology can be challenging because it involves memorizing large amounts of information. Fortunately, mnemonics make learning easier by turning complex facts into simple memory shortcuts. One important area is the Cytochrome P450 enzyme system. To remember enzyme inducers, use the mnemonic CR, APGPS, carbamazepine, rifampicin, chronic alcohol use, phenytoin, griseofulvin, phenobarbital, and St. John's wort. These drugs increase liver enzyme activity and speed up drug metabolism. For enzyme inhibitors, use SICKFACES.com, which includes sodium valproate, isoniazid, cimetidine, ketoconazole, fluconazole, acute alcohol use, chloramphenicol, erythromycin, and sulfonamides. These drugs slow metabolism and can increase drug levels in the body. For opioid overdose, remember CPP, coma, pinpoint pupils, and poor respiration. The antidote is naloxone. Anticholinergic toxicity can be remembered by the phrase hot as a hare, blind as a bat, dry as a bone, red as a beet, and mad as a hare. These symptoms include fever, dilated pupils, dry skin, flushing, and confusion. Cholinergic toxicity is remembered using DUMBBELS, diarrhea, urination, meiosis, bradycardia, bronchospasm, emesis, lacrimation, and salivation. Most beta blockers end in olol, such as atenolol and propranolol. A CE inhibitor side effects can be remembered with captopril, highlighting cough, angioedema, hyperkalemia, hypotension, and renal effects. Important calcium channel blockers can be remembered as very nice drugs, verapamil, nifedipine, and diltiazem. For aminoglycosides, use NOT, nephrotoxicity, ototoxicity, and teratogenicity. Tetracyclines cause teeth trouble, including tooth discoloration and bone growth inhibition. Sulfonamide adverse effects can be remembered as 5S. Sun sensitivity, Stevens-Johnson syndrome, sulfur allergy, stone formation, and suppression of bone marrow. Warfarin is strongly associated with bleeding, and its antidote is vitamin K. For heparin, remember HIT, heparin-induced thrombocytopenia. The antidote for heparin overdose is protamine sulfate. Statins are associated with muscle pain and, in severe cases, rhabdomyolysis. The first-line tuberculosis drugs can be remembered using RIPE, rifampicin, isoniazid, pyrazinamide, and ethambutol. The sympathetic nervous system is associated with fight or flight, causing increased heart rate, blood pressure, and pupil dilation. The parasympathetic nervous system is associated with rest and digest, causing decreased heart rate, increased digestion, and pupil constriction. Drug metabolism occurs in two phases. Phase 1 includes oxidation, reduction, and hydrolysis. Phase 2 involves conjugation reactions, such as glucuronidation and acetylation, making drugs easier to eliminate. When studying pharmacology, focus on 5 key areas for every drug: the drug class, mechanism of action, major side effects, antidotes, and contraindications. Combining understanding with mnemonics and regular revision can greatly improve exam performance and long-term retention. Pharmacology may seem difficult at first, but with the right study methods, it becomes much more manageable. Mnemonics are among the most effective tools available to students, helping transform a challenging subject into one that is easier to understand, remember, and apply both in examinations and in future clinical practice.